you have tennis elbow and go to see your doctor for diagnosis and treatment, it's highly likely on either that first visit or the follow-up, you'll be given a prescription for physical therapy treatments. But the question is, how likely is that treatment to help you fully recover, or at least put you well on your way, in a reasonable period of time? And what if you've already been through a series of visits and it didn't help you? What do you do now? Hi, this is Alan Willette, your tennis elbow tutor, with another episode of the Tennis Elbow Classroom podcast. Now, there's no doubt that physical or physiotherapy treatment helps some tennis and golfer's elbow sufferers recover. However, in my experience, working directly with hundreds of golfers and tennis elbow sufferers for about 15 years now, and from what I've gathered from talking with my Tennis Elbow Classroom program members, physical therapy also seems to let a lot of people down. And in many cases, that's after dozens of visits, months of hard work, and precious wasted time and energy. It's gone forever. Now, I want to make a firm disclaimer right off. My intention's not to disparage hardworking, well-meaning physical therapists. Not at all. Tennis elbow is a stubborn, difficult-to-treat injury. And my skepticism, criticism, and occasional disdain has to do with the overall medical system and how it looks at and treats these kinds of injuries. And since physical therapy is under the umbrella of the allopathic medical system and its symptom-obsessed model, there's quite a lot to criticize, including how that system, in a way, ties the hands of its practitioners. So let's begin with a look at how tennis elbow is typically treated in PT. When most people think of physical therapy, they probably picture exercises, strengthening exercises, mobilization or range of motion exercises, various stretches, and so forth. And although it's true that exercise is an essential part of PT, perhaps the best part, and certainly a proven effective part of tennis elbow treatment and rehab, physical therapy is a system for rehabilitation that has many different potential treatment components. In medical terms, these different components are known as modalities. To the best of my knowledge, the following 5 modalities are the ones most often used to treat tennis elbow. The first is therapeutic exercise, of course, as in exercises done for rehabilitation purposes. Second is cryotherapy, as in ice and cold packs, supposedly to reduce inflammation, but also for pain control. Third is therapeutic ultrasound, or ultrasonography, which uses sound waves to heat or stimulate the muscle and tendon tissues involved. The fourth is extracorporeal shockwave therapy, a more powerful version of ultrasound, you could say, involving a mechanical shockwave that's also used to stimulate the tissues. And finally, the fifth is electrical stimulation, or electrotherapy, or E-stim for short, where electrodes are attached to your skin and currents pulsed into your muscles, causing them to involuntarily contract and twitch. Sounds like a lot of fun, doesn't it? Actually, I had it once and positively hated it. Now, this is not a perfect list. There are many other modalities, and some may be used more or less in any given place or time. This is just 5 of the most common ones for tennis elbow. Now, my impression is that physical therapy has a pretty favorable track record when it comes to things like hip and knee replacement rehabilitation, as well as certain kinds of post-acute injury rehab situations. But chronic tendon injuries, like tennis and golfer's elbow, are another matter. They're much more challenging problems to deal with across the board. And in my opinion, the first reason most medically oriented treatments so often fail, including physical therapy, is that they misidentify and mistreat the problem, starting with the fact that tennis elbow is almost always a gradual, chronic, degenerative injury process, not an acute injury like a sprain or a strain. Now, PT is pretty good with sprains and strains, and there may be some benefit to using ice cryotherapy for these kinds of injuries while they're acute, meaning when they're new injuries that are swollen, hot, and really, really inflamed. Although even that's being debated at this point. But either way, that's not the issue with tennis elbow. Inflammation is not the problem. There may be a little in the very earliest stages, but once the injury becomes chronic, it's gone. And ice is more likely to inhibit circulation and slow healing in tendons that are usually in desperate need of more circulation. Tendons need that inflammatory process because it's the first stage of healing, not an enemy to be attacked. And it's not a good sign that in this day and age, when we've known, thanks to medical research, that tennis and golfer's elbow are degenerative injuries for 20 plus years, that many physical therapy websites are still talking about inflammation as if it were the problem. Okay, so what about ultrasound and shockwave therapies? Well, ultrasound, this kind of ultrasound, known as therapeutic ultrasound, uses sound waves to penetrate and heat up muscles and tendons. This is in contrast to diagnostic ultrasound, also known as sonography, which uses a lower intensity sound waves to get an image of the area rather than treat it. Very commonly used to examine the developing fetus. It's a little confusing though, isn't it? They sound like they must be the same thing. They're similar but different. And ultrasound sounds great in theory, but although we've been using ultrasound to treat all kinds of tendon problems for decades, medical studies don't seem to show that much evidence of a benefit. And I've never encountered anyone who thought it was the least bit helpful in their tennis elbow recovery. Definitely think twice if you're tempted to buy one of those home ultrasound units. They're nowhere near as powerful as the professional ones used in PT clinics. The shockwave therapy is similar to ultrasound, but utilizes a more intense frequency and literal vibrations. Again, without much of any evidence of its effectiveness, at least for the treatment of tennis elbow. And it's been around for decades, and medical studies on its effectiveness have been done. Its benefits apparently marginal and within the parameters of the placebo effect. And I'm not even going to bother talking about e-stim, which I personally think is a ridiculous treatment, at least in this application. What I am convinced of is that the biggest problem with all these modalities is they just don't do enough to break the vicious cycle. The vicious cycle of stagnation and degeneration that's at the root of what's going wrong in the tendon. Tennis elbow is not merely a weak muscle that needs to be strengthened or a minor muscle tear that should heal consistently with steady progress over a few months. It's a significant tendon breakdown, and it's a failure of the body's healing process to repair it. And again, therapeutic exercise is proven helpful, and it's certainly an essential part of any rehab program to turn this around. But the issue with exercise, in my opinion, is that it's often begun too soon. Instead of having a positive effect on tendon regeneration, exercise seems to be aggravating in many cases, often causing painful setbacks. Sadly, if you've done a course of a dozen or more PT visits and had all the usual modalities and you've worked really hard and diligently and ended up making little or no progress, well, I can tell you I've heard this story 100 times. Please try not to get discouraged, though. You're not alone. This has happened to tens of thousands of golfers and tennis elbow sufferers, and it doesn't mean that all you have left for options are cortisone shots and surgery. So the question is something missing? Is there a key ingredient that's usually absent from physical therapy treatment? I would say there is. All the evidence I've seen, objective and subjective, points to the need to physically break up the stagnation at the root of tennis and golfer's elbow. The stuck stuff, like muscle and tendon adhesions and scar tissue. The problem is that this stuck stuff isn't released or minimized by icing the hell out of it or shocking it, and probably not by hitting it with sound waves or physical vibrations. And exercise seems to help a lot more once one has already made some progress in breaking that stuff up and made some progress toward reversing that tendon stagnation and degeneration. I believe the fastest way to break up the sticky stuck stuff, and we're literally talking about layers of tissue stuck together and adhered, is by hands-on manipulation. Muscle and tendon therapy performed by hand on those muscles and tendons. Advanced massage techniques, in other words. Isn't this something that physical therapists routinely do as part of a typical PT treatment? Well, maybe in Europe or Australia, but very little of this kind of manual therapy, as it's officially known, is performed in a typical PT visit here in the United States. Maybe 30 to 50 years ago, perhaps still in some smaller boutique clinics where you actually get some quality personal attention, but not these days in the big therapy mills under managed care. Why? I'm guessing it's because it takes too much focused one-on-one time for the therapist to do a thorough job of it. I just did a Skype consultation this morning with a rock climber in San Diego who has golfer's elbow in both arms, and he was lamenting about how much better, he says, physiotherapy is in Europe, where he often travels and has treatment for his elbows. He said, "Nobody even puts their hands on you here in the States," which does seem to be the case most of the time here, I'm afraid. Well, you do have the option of seeking out a neuromuscular therapist like myself. I'm not a PT, I don't pretend to be, but I am qualified and very experienced in manipulating muscles and tendons and other soft tissues by hand. That's actually the only thing I do. And I'm outside and unconstrained by the conventional medical system. Now, it's not always easy to find someone who has a fair amount of experience and success with these kinds of tendon injuries, and I should warn you that's rather expensive if you're on a budget. But there's another option. What about learning to do this yourself? Can you learn how to be your own therapist? Well, absolutely. Teaching golfers and tennis elbow sufferers how to break the cycle using advanced muscle and tendon therapy techniques, like what I do, is the central theme of my self-help programs. And coming back to the question of exercise, is there tennis elbow rehab exercises you can do at home? Well, yeah, that's the most effective thing that physical therapy has to offer, in my opinion, at least here in the States. And whether you have formal clinical PT treatments or not, you'll still need to do rehab exercises on your own at home at some point in your recovery. Again, I believe that time is best deferred to the mid to later part of one's rehab, not right at the start. And there really isn't any fundamental difference between the exercises you would do in a clinic and what you'll be expected to do at home, except that you won't have the same equipment and you may need to improvise a little. The good news is that everyone has some things around the house they can use to do these exercises. It's not necessary to buy a bunch of special equipment in most cases. Although for one exercise, you might want to get a small handheld weight, which is quite cheap. Once again, I want to make the case that exercise is not the first priority, in my opinion, though. Everything I've learned suggests that exercise is not the way to begin a treatment and rehab program. I'm convinced you should be focusing on breaking the vicious cycle of stagnation and degeneration first, to break up and release those nasty sticky adhesions and scar tissue in your muscles, and to use heat instead of ice to bring more circulation to the area, and to stretch frequently, but not like they usually teach you in physical therapy. I teach what I believe is a safer and more effective way to stretch in my programs. And to learn more about that stretching method, the 3 simple rehab exercises you can do at home, and most importantly, how to become your own hands-on therapist, check out my tennis and golfer's elbow self-help programs at tenniselbowclassroom.com and golferselbowclassroom.com. And if you're listening to this podcast somewhere you can rate or comment, like iTunes or YouTube, please give me a rating, a thumbs up or a comment, and please subscribe. Thank you.